Hello and welcome. In this video, you will discover the top dental hygiene tips for optimal oral health. Brushing your teeth before you go to bed and again in the morning after eating breakfast is a good start, but this is not nearly all the attention that your mouth demands. Even a rigorous oral hygiene routine can be undermined by some bad habits. It helps to understand proper brushing and flossing techniques and to have the right tools and supplies in your medicine cabinet. But we want to help you take your mouth cleaning to the next level, and the tips provided in this video are designed to help you do just that. Brush twice a day. Brushing your teeth at least once in the morning after breakfast and again before you go to sleep is essential. It helps to eliminate the bacteria and plaque accumulation that can result in periodontal disease and even tooth decay. Brush for 2 minutes. The American Dental Association recommends that when you brush, you should continue for approximately 120 seconds. Below this mark, the ADA has found that a person is much less likely to remove as much plaque from their teeth as they should. Employ proper brushing technique. It is recommended that you hold your brush at a 45-degree angle and so that it overlaps the gums. Move the brush in small circular motions over one tooth, and then move on to the next tooth. Be sure not to brush so hard you damage the gums and/or teeth. Don't brush too often. Dentists used to recommend brushing after every meal, but not anymore. Twice a day is now the recommendation because if you brush too often, you can actually wear down the enamel of your teeth and even damage your gums. Avoid brushing too hard. Brushing too hard or even using a hard bristled brush can damage your tooth enamel and your gums. This may lead to tooth sensitivity, as well as enamel damage and gum erosion. Use a soft bristled brush. If you have a hard brush, swap it out with a soft bristled brush as soon as you can. Some people prefer harder brushes for a cleaner feel, but they can be abrasive and actually cause damage over time. Check out Nimbus Extra Soft toothbrushes online. Choose a fluoride toothpaste. Purchase toothpaste that contain fluoride because it strengthens tooth enamel and thus helps to avoid tooth decay. Fluoride also creates a protective barrier for your teeth that can help avoid the negative effects plaque and bacteria can have. Don't ingest fluoride. Avoid drinking fluoride. Spit out toothpaste and rinse. As for drinking water, the U.S. has lowered recommended fluoride levels, but some experts still have concerns of consuming it and having it directly enter the bloodstream. If you prefer to eliminate fluoride from your drinking water, you can install a reverse osmosis filtration system, which will remove it along with other substances. Pay attention to your teeth and gums. If your gums and teeth are telling you something, take notice. Don't ignore gums that bleed or look inflamed. If you experience aches and pains, consult with your dentist to ensure that these aren't indications of a more serious condition. Swap out your toothbrush often. Toothbrushes become ineffective with wear rather fast, so the recommendation is to swap them out every 3 months or whenever you have been sick. Keeping a toothbrush too long also presents the risk of harmful bacteria that can cause gum disease. Clean your toothbrush holder. Many of the germs in your bathroom can accumulate in your toothbrush holder and contaminate the brush. In fact, some studies have found toothbrush holders to be the third most contaminated household item behind dish sponges and kitchen sinks. Disinfect your toothbrush. Disinfect your toothbrush regularly. An effective and easy way to do this is to soak the brush head in hydrogen peroxide using a bathroom cup. You should let it soak for at least 15 minutes and as much as 30 minutes before allowing it to dry prior to use. Don't forget the tongue. Food particles, bacteria, and even plaque can, and often do, accumulate on the tongue. Such buildup can cause halitosis, but also more serious oral health issues. You can use your toothbrush to clean your tongue, but there are also tongue scrapers, which may be more effective. Floss twice daily. Flossing can remove food particles, plaque, and bacteria from between the teeth where a toothbrush is unable to reach. Flossing can also improve the health of your gums, thereby helping to prevent them from bleeding. Floss correctly. The proper way to floss is to wrap 18 inches of the thread around your fingers and then move the floss gently between 2 teeth at a time using a U-shaped motion. Rinse your mouth with water. After every meal and even after every snack, healthy or otherwise, you should rinse with plain water. Swish the liquid vigorously. Seek to force the water in between the teeth so that it dislodges any food particles that have been trapped there. Drink lots of water. It's a good idea to drink plenty of water for your overall health, but drinking water has oral health benefits too. It encourages saliva, which helps you get rid of food particles and bacteria. Of course, water is also a much healthier choice for your teeth than most other drinks. Take diet into account. Diet matters for your teeth and gums too. Ensure that you are getting the recommended daily intake of calcium, magnesium, vitamin C, and vitamin D, which keep teeth and gums strong and help to prevent bleeding, cracking, and breaking. Snack on crunchy vegetables and fruits. Opt for vegetables and fruits that are raw, coarse, and fibrous. Examples include apples, carrots, celery, cucumbers, lettuce, and pears. These choices clean your teeth naturally and stimulate saliva production, which helps to neutralize acids in your mouth. Avoid acids and sugars. Sugars convert to acids in the mouth, which can then erode the enamel of your teeth. This is what leads to cavities and eventually decay. This includes acidic fruits, so only eat such items in moderation, and be sure to rinse your teeth thoroughly when you're finished. Don't use tobacco. Of course, you know that tobacco often leads to cancer, but it can have many terrible effects on your teeth even in the short term, including tooth decay. Tobacco users are also at greater risk of tooth discoloration, periodontal disease, oral cancer, and many other issues. Drink alcohol in moderation. The Mayo Clinic warns that excessive alcohol consumption irritates oral cells and makes them more prone to mouth cancers and other issues. In this context, moderation means up to 1 drink a day. However, not drinking at all may be the ideal choice. Protect your teeth. If you participate in activities where hits to the mouth are common, protect those pearly whites. Talk to your dentist about a personalized protective mouth guard that you can wear during those activities to keep your teeth from getting bruised, knocked out, or otherwise damaged. Saving a lost or broken tooth. If your tooth has been broken or knocked out, you may be able to save it. You'll need to see a dentist immediately. In the meantime, store the tooth in milk, and if that isn't an option, you can hold it in between your cheek and gum to avoid it drying out. Avoid oral piercings. Piercings of the cheek, lip, and tongue can actually damage your teeth and gums as well as lead to infections and even more serious conditions. Some of the common oral complications associated with piercings include bleeding, chipped teeth, gum recession, nerve damage, and swelling. Visit your dentist twice a year. See your dentist at least every 6 months, and more often if he or she recommends it. A dentist can diagnose and treat most issues well before they are serious, and they can monitor for indications of cavities, gum disease, mouth cancer, and other serious oral conditions. If you enjoyed this video, please like, share, comment, and subscribe to our channel. For more information about ways you can achieve optimal dental health, visit us at scottsdaledentalecellence.com.